Raleigh is the program coordinator of healthcare partnerships at Public Health Solutions and has been working incredibly hard to help New York City during the coronavirus pandemic. What is she doing? Well, she's providing essential resources to at-risk COVID-positive patients who have just been discharged from the hospital. Raleigh, first of all, thank you for your work on the front lines. We so appreciate everything you're doing.
Thank you so much, Emma. Thanks so
I want
much.
to break it down from the beginning. Let's talk about what public health is and how it relates to the coronavirus.
Yeah, definitely. I think that's such a great and important question. Public health is about creating conditions where people can be healthy. Health is often thought of just to be the result of individual actions that are, just related to medical things, such as going to the doctor. But in reality, there are much larger forces and structures at play that determine a person's or a community's health. Life expectancy varies by more than 20 years, depending on where a person lives in the United States. And while it may sound impossible because of the wealth and robust healthcare system that exists in this country, this varies due to the wealth gap and other social disparities, such as structural racism, cycles of poverty. So public health infrastructure is meant to reduce these disparities. And if we create the social and environmental conditions that prevent sickness and promote well-being in the first place, we can help individuals and families live healthier lives and also save on enormous costs of hospital care and treatment.
So let's break that down even more. What are some of the social determinants of public health?
Yeah, well, according to the National Academy of Medicine, medical care is estimated to account for only 10 to 20% of all health outcomes, while 80 to 90% of health outcomes are based on the social determinants of health, such as where people work, live, their level of education, and many more factors. And kind of all this to say, my work revolves around eliminating health disparities through innovative public health programs focused on the social determinants of health in New York City.
So what are some of those things? Tell me a little bit about what you were doing pre-COVID-19 before we jump into the global pandemic and what you're doing now.
Yeah, definitely. My pre-COVID work focused on forging and strengthening partnerships across sectors of health in New York City. So I worked on pilot initiatives and longer-standing programs that united the collective power and expertise of healthcare orgs, so hospitals, insurance companies, with the knowledge and strength of community-based organizations. So this kind of idea values the community as an asset and empowers that community to heal itself. And so I supervise and have started to help to develop programs that are meant to combine resources, often through like a cool tech platform, to effectively and equitably reach and serve populations that have been historically marginalized and underserved in New York City.
And now New York City is the epicenter of this crisis. Let's break that down a little bit. Tell me about how the coronavirus has consumed the work that you're doing, how it has consumed the healthcare system, and tell me about your response.
Yeah, so the programs that I just kind of detailed, they were all located in places such as emergency rooms or homeless shelters. So places that are now hotspots and are just being used for COVID-19 medical treatment. And so I have been collaborating with New York City Health and Hospitals, which is the public health hospital system, to create a new initiative to redirect all the work that's happening in those places. So across 4 boroughs, all but Staten Island, and across over a dozen hospitals, everyone is making calls to patients who just left the hospital who are COVID positive and providing essential services. So think food, health insurance, medication delivery, social isolation, so mental health resources, domestic violence, even funeral burial resources, all to people who are recovering from COVID, homebound and in need. And so our efforts right now are focused on providing all these necessary social services so that people don't have to put themselves or others at risk. So in this way, this non-medical intervention is playing a role in flattening the curve and saving lives.
I want to talk more about how many aspects of coronavirus we weren't even able to think about before the pandemic hit. I know you spoke about everything from funeral burials to making sure we have enough hospital space. Tell me a little bit more about what you've realized during this time period?
Yeah, I think my work has shown me that coronavirus is not an equalizer, it's a revealer. Health inequity has existed long before this crisis, but I think COVID has exposed and unfortunately amplified those disparities. Um, I mean, one factor that plays a huge part of my work right now, I think should be recognized by, is that being able to socially isolate and quarantine is a privilege that many people cannot afford. Um, for example, someone who doesn't have health insurance often can go to one of the hospitals that I work with to get their prescription. But right now, those hospitals aren't delivering. So people are faced with the, you know, choice of, do you go without your medication or do you put yourself at risk or others at risk? Also, another large population I work with are people who are undocumented. And, for example, they can't rely on employment benefits. If they lose their job, could potentially become food insecure. So I think there's inherent focus on equity in my work and good public health work. And that's definitely so much more important now, or just it's really that importance is highlighted because it's about, serving everyone, not just those who are traditionally protected.
I know that obviously we're living in an emergency situation right now, and you've just told us a lot about the inequity in public health. Has there been conversation yet about how to fix that?
Yeah, that's a great question. I mean, I think the work that I was doing before pre-COVID was looking at how to address that and how to go from, a couple organizations or one hospital implementing these like larger safety nets versus making it something that's structured and something that's funded. And so I think, if anything, this is just demonstrating that the importance of continuing projects like that and viewing them as something that's just not, oh, that's great, but like this is essential.
I know you work a lot with community-based organizations. Can you tell me a little bit about the role that community-based organizations play in this crisis?
Yeah, well, I'm definitely biased because Public Health Solutions, my work, is also a community-based organization, but I just think they're doing such amazing things right now. So the work that I do, I don't provide services. I more so supervise and help create and implement programs, but my organization also does provide direct services such as things for women, infant, and children, families that are not documented, sexual and reproductive services, more. One great CBO I work with called SAC, South Asian Council for Social Services, they came with this really innovative solution to help those who are food insecure. They actually have been paying taxi drivers from the local community to deliver meals and food because they have been struggling in this time where it's a lot harder to find work. And so I think one part of working with CBOs and working for and working with CBOs that has been really humbling to hear is just stories every week of how our response work is reaching New York City residents. It's just that person-to-person interaction that has been so striking. That many of the people that we're engaging with express so much gratitude, but I really think just deserve someone to listen to their anxieties and needs and respond with compassion. And a part of COVID response work is not just to assist with key resources, but also to provide emotional support and express the message that someone cares about you and is listening.
And that's so wonderful that you and other community-based organizations are providing that support for people. And now I kind of want to hold a mirror up to that. And the people who are working on the front lines also need emotional support and also need self-care. You have done some work with that. Can you tell us a little bit about it?
Yeah, definitely. One thing that I've been working on kind of in this supervising role is providing support to the people who are making these calls. And a lot of these people are also preparing food or delivering food to people who are COVID positive. And, this work is really difficult and the landscape is just constantly changing and there's so many conflicting messages. So, when we were creating this initiative, we had to think about how to include guidance around things that are really difficult, but you can't ignore, such as, combating stigma targeted toward the Asian community, dispelling rumors, which come from everywhere, and even like providing basic grief counseling for those who have lost loved ones. And so, in both like prepping people who are going to call patients, I also compiled various healthcare resources for public health and community health workers at the time, utilizing some available resources that are fun and lighthearted, like online dance videos or a virtual museum tour, to provide a little bit more in-depth mental health tips on burnout and secondary traumatic stress. And I think in this moment of collective trauma, all need to be thinking about our mental health. And I'm just really grateful that I can bring that to the work that I'm doing.
Absolutely. After all, this is a global crisis and it's taking a toll on many people, especially those working on the front lines. So thank you for doing that work. Before we get to the last couple questions I have here, I want to encourage everyone who's listening to ask a question. Raleigh has been on the front lines doing incredible, incredible work. Oh, we have a question. In New York City, doing anything in particular to reach out? Are you doing anything? Is New York City doing anything in particular to reach out to lower income and more at-risk communities?
Mm-hmm. Thank you so much. That's a great question. The answer is yes. And also could always be doing more. The initiative that I'm working on is really focused on that. I'm not the one who helps compile the list of patients that we call, but the people who are doing that at the health and hospitals are going through thousands and thousands of patients and trying to kind of find those who are most marginalized or served. And also Public Health Solutions, the organization that I work for, we have a more like targeted social media campaign to assist those who either are at risk or have become at risk because of the current crisis.
Which is actually a great segue into my next question. And again, if you have any questions, please, please, please put them in the comments. Raleigh is has an abundance of knowledge on this. Let her answer your questions. My next question for you is, what are the implications of this crisis?
That's a great question. And I think none of us exactly know how far those implications will extend. I think when I've been considering this question, I've been thinking a lot about what I hope will come from this and the insight that I hope we gain. And actually, my CEO just published a really great article kind of on this topic. And if you don't mind, I was going to share a quote from the article.
Yes, please share it.
Yeah. So this is from my CEO. Her name's Lisa David. She said, "The coronavirus pandemic has become a reckoning for the safety net that keeps millions of Americans afloat, creating a rare opportunity to make major changes and emphasize investments in safety net programs that support vulnerable populations. For the health of our nation, we need to invest smarter." And so, kind of like thinking about that, I hope that this crisis will restructure our priorities around public health. As important as the social determinants of health truly are, they are not traditionally or formally funded in our healthcare system. And part of that is because the social effects on health are harder to measure. There's so many compounding factors, and they often take years to kind of collect the data. But I think with this crisis, we can acutely see how these social dimensions are having a serious impact on health. That is, life or death. So I hope that this crisis will be a wake-up call or a call to action that we have to invest in the collective care of our communities and do so with a lens toward justice and with a collaborative spirit.
I think that is a beautiful and meaningful quote, and something we all need to think about right now, the importance of investing in our public health system. And I have another question over here. What is happening to the homeless population when the subway is closed for cleaning? Have you or your company done any talk around, have you guys had any talks around that or problem solving ideas around that?
Yeah, that's also a great question. One of the CBOs that we work with is called Health People, and they're also really amazing. They have a peer model where they have people who have who are either currently home insecure or have been homeless in the past um, become peers in education and diabetes self-management education. And so the project that I focus on with them is about asthma. And so they've been working really hard to try to stay in touch with a lot of people who are homeless at this time, which is really, really difficult. And I think kind of what they've been working on is trying to reach out to homeless shelters and NYCHA housing, which is like a New York centered kind of program for housing people who are home insecure. And I think the question of the subway system is an amazing one, and I don't really have an exact answer other than I think the resources that we look at when providing this to discharge patients have like this understanding of some people say can't go out to a food pantry to get food, so we have delivery services, and there's also kind of some like housing options as well for people who are like insecure in that respect. And so yeah, I think it's something we're all working on. It's something that has to also be a part of this work.
And I guess that is actually a perfect segue into my last question. And again, if you're just joining, welcome. If you have any questions for Raleigh on public health related to the coronavirus or the work that she's been doing, this is your last chance to ask now. Please ask in the comment section. She has so much knowledge on this topic, and I know she'd be more than happy to answer the question. But my last question for you is, how do you think the coronavirus is going to change our outlook on public health as a community?
Yeah, I think it's a great question. I think the way in which this country often functions is to consider those who are able to contribute in a specific way, that often being monetarily or with a certain sense of capital by our country. But often when it comes to health, it's those who are most marginalized and most underserved that need that safety net that we've kind of been talking about. And so I think public health is really about looking at our systems of care and looking at, do we value life and whose lives do we value? And I think this crisis has really exposed a lot of our bigotry and a lot of the holes in the public health system. And I hope that this is an opportunity to restructure and, mend that.
Wow. Well, that is a great way to end this interview, Raleigh. You are part of that mending process, and I thank you for all the work that you're doing, and keep fighting the good fight. I know everyone who's listening right here is so proud of you. Thank you, thank you, thank you.
Thank you so much, Emma. It's been a pleasure.
Thank you, everyone, for tuning in. This is Next Gen News, and until next time, I'm Emma Barnett. See you later.